Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. George Touliatos, brought to you by his book, Bodybuilding, The Good, the Bad, and the Ugly. You can get that at his website, gtool.com, or on Amazon.com. You can also read the doctor's work every month in the pages of Muscular Development magazine. He's also been a contributor to many other publications and books, like William Llewellyn's Anabolics. Please welcome from Athens, Greece, Dr. George Touliatos. How are you?
Hello, Ron. Welcome back from California.
It's good. I had first time back there in 5 years. I used to live there. I lived there for 10 years. So
yes, I know.
It's not unfamiliar to me, but yeah, I like my house. I like Massachusetts. Cold, and we got a little snow, but this is where I'm from. Yeah. We have 6 questions this week. We didn't get as many, so next week we'll probably have 30 questions. That's how it seems to go. So if you're ready, let's dive right in. Number 1. This is a question because he didn't really elaborate. What would the doctor recommend for knee osteoarthritis? So I guess he means what kind of medications or PEDs or what would help?
Well, the classic deal with orthopedic surgeons is to perform a surgery that they introduce an artificial joint. They're made up from mainly titanium. So this happens almost in third age, in old people, in the hip joint and on the knee joint. Now, if you have osteoarthritis, then things are serious and you cannot, of course, jump or do squats or leg presses. And mainly you have to rehabilitate and do physical therapy and just walk, not jogging,
Yeah.
But as a preventive, in order to avoid ending up there, apart from non-steroidal inflammatory drugs that mask the pain and perhaps they lower the local inflammation, you may use several agents such as MSM, glucosamine, chondroitin sulfate, hyaluronic acid, and perhaps injectable also, which is provides lubrication for joints and mainly menisci in the knee joint. And also you can use collagen along with vitamin C and vitamin B6 because vitamin B6 is able to absorb the protein. Now, collagen is synthesized by ascorbic acid, which is vitamin C, And also you may add some omega-3, DHA and EPA, which is also anti-inflammatory, and some turmeric as, anti-inflammatory also supplement. And now, in osteoarthritis, the surface of the bone is covered by hyaline cartilage. This is connective tissue, and this is the shiny surface when we eat the chicken, for instance.
Oh, yeah.
And we have this shiny, glistering surface that is covered by hyaline cartilage. This is degraded, it's getting rusty, for instance.
Yeah.
And then we need to form another joint, and by titanium, the distal end of one surface. So it's either on the between the femur and the tibia that form the knee joint, or the head of the femur that goes to into the hip and forms the hip joint, into pelvis. So use this variety of supplements along with non-steroidal inflammatory drugs.
Okay, cool. Next question, doctor. Hi, doc. My body holds a lot of water whenever I introduce carbs into my diet. I can lose a lot of water when I take the carbs out. Is there any way to keep the carbs in and not have my body hold so much water? I'm 26 years old and I am natural.
Yes, it's true that ketogenic diet may be able to get you rid of the retention that comes out of insulin response as a result of carbs. But of course, you're going to feel tired and flat as a weightlifter, as a bodybuilder. Now, there was a very famous supplement back in the 90s called hydrocitric acid, I think, that was able to not utilize the carbs it was used mainly for dieting, and I believe this supplement was introduced in hydroxycut, for instance, by Muscle Tech. And HCA, hydrocitric acid, was able to utilize the carbs, but not, You could still eat carbs without getting fat. In this way, like for instance, we have cytosine or orlistat, that you're able to eat fat but eliminate it in the stools, in the toilet. So the same happened with hydrocitric acid by eating carbs, and not getting fat out of carbs. Now, another way, of course, would be to substitute carbs with vegetables that are fibrous carbs and not starchy carbs, Of course, avoid sugars, so juices and fruits. And add some fiber, for instance, salads, that are not capable of holding water, just the starchy carbs, and produce the insulin spike.
Yeah.
Yes.
I'm curious, you said orlistatic acid was the
orlistat, Xenical, the drug,
right,
was able to eliminate your fat in the stool, in the feces.
Okay. No, I'm saying, what was the one that you just mentioned that was in hydroxycut that helped you eat more carbs without getting fat?
Hydrocitric acid, HCA, hydrocitric acid. It was a plant-based material, was not a chemical substance, like the.
I'm saying, why didn't that become more? You'd think that'd be like $1 billion.
I don't know.
Right now.
Maybe it was snake oil. It didn't work.
It must not. Because that sounds like a fantasy. You can eat carbs and not get fat, right?
Yeah.
I think that's actually a fantasy of a lot of women, is I can eat all the carbs I want.
It was a very famous supplement, hydroxycut.
Yeah, I remember HCA. I do remember that, but it's gone.
Was the Mahuang that worked, of course.
Ephedra was the bomb. Oh man, that stuff worked great.
I missed.
We all do. Please, I have 2 questions. I am on TRT 80 milligrams every 5 days and 1/2 exemestane twice a week. What is for you the best protocol to restore fertility? My HDL is low as well as my triglycerides, my LDL and total cholesterol. So they're all low. My lipids are on range 1 gram per kilogram of body weight. Do you have some advice for increasing HDL? Thanks a lot. So he wants to restore fertility and increase his HDL.
Okay, from what I sound, this guy abuses aromatase inhibitors for no reason. He just uses 100 milligrams and he uses every other day exemestane, which is the most potent aromatase inhibitor. Come on, this is crazy. So he has to get rid totally of aromatase inhibitor. And that's how HDL is going to catch up, because he has 0 estrogens. And estrogens are heart protective and also are responsible to synthesize HDL, LDL, because they are manufactured in the liver. So too low estrogens coming out, or aromatase inhibitors will crash on HDL. Now he has to also take niacin, 100 milligrams with every meal, and perform 30 minutes of cardio every day. Quit smoking if he does. You don't need it with 100 milligrams. Come on, this is crazy. Aromatase inhibitor at all. Now, about his fertility, along with TRT, right?
Yeah.
So he can introduce 25 milligrams of proviron that will elevate FSH, and proviron monotherapy is tricky. It elevates FSH, but it slightly decreases LH because it's DHT is a steroid. It's an androgen. It's a steroid molecule, but it slightly decreases endogenous testosterone production, but it's tricky because Thomas O'Connor also said that it's used for improving sperm production. So a little bit of proviron, 25 milligrams, along with vitamin E, which is responsible to improve motility in spermatozoa. So 400 IUs with meals because it's a fat soluble. And now he has to use 2 peptides, HCG, and I suggest 100 IUs every day, or 250 twice a week, or 500 milligrams once a week, 500 IUs, once a week. But the best is to introduce small amounts, like mimicking the endogenous production, and also HMG 3 times a week, 75 IUs. But HMG synthetic FSH, it improves also the volume of the semen, the cum shot.
Oh, wow. Okay.
Wait,
what was that? I got to write that down. What's that? Just kidding.
So, yes, you're gonna see balls, improving in size, And I actually, 3 patients of mine managed to to get pregnant, their wives. They were still bodybuilders, you know.
Yeah.
And so it's miraculous, this combination, HCG, HMG, proviron, you know, and vitamin E. And sometimes you can introduce, instead of proviron, also you can use some like clomiphene. But yes, these two peptides are the real deal, you know.
Okay.
You need at least 4 weeks a month, you know. And of course, you need to take a seminal vesicle, you know. I'm sorry, a seminal diagram, a spermodiagram.
Oh, that's like a scan.
Yeah, you ejaculate, you know,
Yeah.
but you have to stay 72 hours, 3 days from a sex or a masturbation in order to have a good volume of.
Oh, so that's how they see what your sperm count and motility is?
Yes, yes.
Oh, okay. I didn't know the name of the test. Okay. Hi there. My name is Chris. I really appreciate Dr. T for your time and effort serving the bodybuilding community. I heard Dr. T mention a couple times using parabolin, tren hex, during his cycles. Can he please explain what is parabolin? What makes it different than other tren? What are the benefits from it? There's not enough info on the internet on it. Thank you.
Well, parabolin was the only version of trenbolone which was for human use. It was synthesized in the 90s, and actually this is what Dorian Yates and Ronnie Coleman were using, and Kevin Labroni.
Yeah.
It was an intermediate ester between the acetate and the enanthate, so it's kind of intermediate, resembling a half-life maybe of enanthate, you know. I'm sorry, maybe of propionate.
Right.
Anyway, it was administered twice a week, approximately, the hexa ester. And it was smooth. It was not painful. It was 76.5 milligrams, I think. It was 1.5 ml. The ampoule was very peculiar.
Yeah.
And it was made by Nigma in France.
Right.
It was withdrawal in 1997. It was a white box with blue lines and dark. Yes. And this is, of course, no longer manufactured. So I was using this, you know, twice a week. Instead of injecting every other day the acetate, you know, enanthate is more rare, but parabolin was for human use because Phenaplix and Finajet were for cattle.
Yeah.
And enanthate also was not, it was not over the counter for human use. So the parabolin was used for cachexia, for HIV patients who already developed cachexia, not just positive, you know.
HIV positive, yeah.
Yeah, and also cancer cachexia. So wasting mainly, yes.
So did you use
yes,
that?
Yes,
how did it compare to regular tren if you've used regular tren?
Well, as far as I remember, there was no coughing. Coughing to me occurred with acetate. And also it was very smooth. It was not painful at all. And I used it twice a week, I remember.
Yeah.
It was parabolin, yes. Trenbolone, but it's the same substance. That doesn't mean that trenbolone is more strong. But if you compare the milligrams, now 100 milligrams of acetate will release 90 milligrams out of it. Now, enanthate 70, perhaps hexate's 80, like the propionate. So if you want to get most of it out of the drug, you have to use, of course, acetate fast esters that liberate more of the substance because the ester does not hold. But it's also faster getting rid of out of the system, you know, and it also enters more rapidly to the system.
It's interesting because a lot of people now, because we don't have parabolin, it hasn't existed in so many years. A lot of the guys,
underground labs, of course.
Yeah, but people, you know, bodybuilders talk about it like it was magical compared to all the tren that we have now. Because tren,
you know, it was magical because it was pharmaceutical grade. Back when I was competing in 2000, I was just using 5 steroids, but all of them were with pharmacy grade. Now you can use 10 steroids. You don't know which one works. You know, as we told the previous show.
Yeah, some of them are vegetable oil, I'm sure. But you know, was it William Llewellyn has that roid test kit?
Yes. And as a matter of fact, when I went to Denver, he offered me pro bono 2 boxes, 2 kits for growth hormone. So I checked out, yes, and it's very simple and it works, yes.
I need friends like that. Okay, next question. Simple question. Why does low T cause erectile dysfunction and low libido? Why does TRT reverse it? I'm asking scientifically. Is it an increase in nitric oxide? What's the reason?
Yes, this is a complex question. Of course, the second part of it, the nitric oxide, it's true that testosterone improves nitric oxide production, which is also induced by arginine and citrulline, and is responsible for vasodilation in the heart also. That's why optimization of testosterone helps the coronary arteries by dilation and heart flow, and blood flow. And of course, in the cavernous bodies of the penis, actually the penis is a large vessel,
Yeah.
full of blood. So vasodilation will improve. But however, the most tricky part of this question is how the heck testosterone make you horny?
Yeah.
Okay. So I searched physiology and urology, but my books in English back in my university, and what I found out was that testosterone affects the limbic system in the brain. Now, the limbic system deals with behavior and emotion, but behavior mainly. And limbic system is affected also by trembolone. So, limbic system belongs in the middle of the brain, mesencephalon, and includes amygdala and hippocampus, very special areas dealing with behavior. And actually, in magnetic resonance image of long-time abuser of trembolone, these are enlarge these areas with also cellular apoptosis and necrosis. But testosterone, it affects those areas in the limbic system, and it just improves, these primitive emotions of aggression and of sexual desire. So that's why I'm telling, if you don't have testosterone, you don't have the urge from the brain,
Right.
To get laid with somebody. It's different.
That's why if you have low testosterone, you just take Cialis or Viagra. It's not going to do anything, right?
No, yes, because exactly these 5-PED PDE drugs, they just vasodilate. So you just have an erection without wanting to have an intercourse. But when you inject some testosterone, you start masturbating yourself because you want to have sex with somebody, Yeah. And actually, there was a belief that it's wrong, that gay people were having low testosterone. Bullshit. When you introduce to a gay man testosterone, he wants to have more sex with the same sex, Yeah, so it's not about that there are gays that do not have, because there are also active gays, and gays that passive also. But anyway, it has nothing to do with it. But if you introduce estrogens like the transgenders do, then change their hormones, then the sexual desires, of course, changes. Yeah. So men who turn to women, they remove all the androgens and they introduce estrogens to themselves. That's why then they start feeling like a woman. It's a chemical thing, it's brain chemistry. Yeah. And it's, of course, brain. The mind controls the body, as Arnold said.
Yeah. I mean, anyone who thinks gay men have low testosterone,
no. There are some gays, we have to admit that they act not manly, okay?
Right.
They may have low T because mainly they're passive. They're not active in the sexual drive. But if you introduce to a gay man testosterone, he becomes more. Have you seen in the gay parade some macho bodybuilders?
I've seen tons of, if you're in the bodybuilding industry long enough, you're gonna run into a lot of
Bob Paris and his boyfriend.
Jacked. There's tons.
Yeah, Bob Paris Bob Paris and his boyfriend. They were interviewed by Oprah Winfrey.
Yeah, well, we have.
They were huge guys. Of course.
I don't know if you've ever heard of. Have you ever heard of Provincetown?
No.
It's a town on the. Cape Cod is a big vacation spot in Massachusetts. So at the very end of Cape Cod, Massachusetts has looks like a little arm sticking out like that. Provincetown is at the very end, and it's a huge resort town, huge vacation town for gay men and women. And they have they have they have a couple big events in the summer, and I see a lot of them are my Facebook friends and everything, so I see a lot of the pictures, and there's a lot of guys who are very big and muscular, tons of bodybuilder types, not all competitors, but definitely weightlifters.
I believe that bodybuilding is a gay subculture. Because why? Because a bodybuilder is the ideal alpha male for a gay to fantasize. Yeah. Tanned, oily, shaved, pumped, huge, ripped. Come on, this is like Pamela Anderson for us.
Yeah. I mean, any bodybuilder, any male bodybuilder will tell you, if you get messages on Instagram or Facebook, it's going to be, saying you look great or trying to be flirty, it's going to be way more men than women that are trying to talk to you. Way
and
more.
also in the streets, I get the envy, attraction out of men.
Yeah.
Some women maybe, they feel afraid, but men feel kind of even say wow, or they feel jealous,
Yeah. I'm going to help you with some English pronunciation, Doc. You say penis, we say penis.
Or dick, or cock.
Yeah. Huh? Well, then you can't mess that up, but it rhymes with cleanest or meanest. That's from the rap song OPP from the 90s. Okay. Last question, doctor. Hey, doc, do you think it's necessary for a healthy individual without blood sugar issues to use berberine or some other glucose disposal agent to improve insulin sensitivity while using MK677 up to 25 milligrams a day? Can blood sugar climb to dangerous levels on MK677 for someone, as I already said, without previous issues in that department?
No, as a matter of fact, I don't think so. It's necessary because all these secretagogues that release endogenous growth hormone production through growth hormone releasing hormone, they just do not lead to super physiological levels of IGF-1. So either MK677, sermorelin, or GHRP6 or GHRP2, they elevate within optimal levels of IGF-1. That's why they are effective just for recuperation and perhaps some fat burning in overdose. Abusing growth hormone, of course, elevates A1C because it releases glucose from the liver into the bloodstream. So this is how growth hormone becomes diabetogenic. I'm using growth hormone the last 2 years in small amounts. So if you take the 2 years the growth hormone have been using, it's roughly 2 I use a day. So I never, of course, I watch my diet. Okay, I avoid eating crap and sugar and stuff like that. So my A1C ranges from 4.9 to 5.1. So if you don't eat crap and sugars and all this trans fat and refined carbohydrates, you can still keep the A1C and the insulin sensitivity low.
Yeah.
Right. And of course, growth hormone works much better in low carb state because it favors more the fat burning process. But also, as we have also said that insulin it's counterproductive for the growth hormone because it hinders its one metabolism against the other. But I don't think you need berberine just with using this. I was using metformin right after my GH cycles in order to lower my allegedly, insulin resistance.
Yeah.
But then metformin has other side effects. It lowers mTOR and the muscle growth. It gives you GIT bloating. It may lower cobalamin levels. I use now, of course, some berberine. A patient of mine sent it me from Canada. But I use growth hormone, of course. I do not use secretagogues. So if this guy switches to growth hormone, yes, you may use berberine instead of metformin because metformin along with growth hormone is not a good idea. So either before or after the cycle of growth hormone, otherwise use berberine and chromium picolinate also because chromium helps the synthesis of insulin. So there is some chromium within this insulin molecule. So chromium and how you say this? No, berberine. When we eat something and we tasty, cinnamon. Cinnamon helps.
Oh, cinnamon. Okay.
Cinnamon, yes, helps with insulin resistance. Using some cinnamon with the fruits, for instance. Yes, cinnamon, chromium, and berberine. Do you remember vanadyl sulfate back in the 90s?
I sure do. I definitely do.
We were taking this with the meals because it was supposed to be a mimicker of insulin and enhance the utilization of carbs.
It didn't do anything for me. Did nothing. Yeah. I remember that was around, I want to say that was around 94, 95. It was a big deal. Everyone wanted vanadyl sulfate. But,
me too. Yes, me too.
One of those, one of the many supplements that came and went. Yeah.
Do you remember Smilex?
Yeah, Smilex, ginseng, bee pollen, boron. Yeah, I started buying supplements in
HMB.
HMB was a little later, but I remember even before that, I remember like in the late 80s, the supplements we had were like ridiculous, ridiculous. Yeah, thinking
First
back.
time I used supplement was in 1990, 1996, 1997. Yeah.
Wow. That's the first time you used any supplements?
Yeah, when I was 24, yes.
Wow. Okay. Well, it's a lot harder to fool a 24-year-old with weird, crappy ingredients. Anyway, well, doctor, thank you. We had a quicker show this week, but guys, if you want to leave your questions, if you're watching this on YouTube, leave them right here in the comments. Doctor will get to them next time. We also have a thread on musculardevelopment.com on the Noble forums called Questions for Dr. T.
My next article on the online will be the pharmacokinetics of steroids. So
Okay.
fast acting, the low acting, the aromatized one, the non-aromatized one. So Alan Golding told me it will be released this week.
Yeah, so I want to let people know, not only do you have the magazine column, we have the show, but you can also get new articles from the doctor on musculardevelopment.com. You're averaging about one a week. You're doing one a week, right?
Yeah, I have already published two, the off-season gaining cycle and the cutting cycle, yes.
Yeah, so good stuff, guys, if you want to check
that. Just talking about drugs on the online, okay, because I wanted to, as a doctor of testosterone, I want to get people more familiar how to prevent and to get familiar with more drugs, because in the magazine, I also write other things like mortality or the history of pets. The two upcoming articles will be history of pets and mortality of bodybuilding. Anyway.
Good info you're putting out there, Doc. We appreciate it. Yeah, if you look at the comments, a lot of the comments on the YouTube videos, Doctor, they're not questions. They're just very, very grateful. They're very thankful that you're doing this service for the bodybuilders of the world, because Dr. O'Connor.
Back when I started, there was no internet.
Yeah.
And we start waiting for one every month for the magazine and translate it, Yeah. Now the kids are very, very lucky having the online, but
spoiled.
Yeah, spoiled, but it's a tons of information and it's also misinformation. So it's risky, it's tricky.
Yeah, like I said, back in the old days, if you had a question about drugs, you'd ask some big guy at the gym, and chances
bro science, yeah.
Bro science, and back then, 9 out of 10 times the information was probably incorrect, or at least only partially correct. But now, 2019, we're almost 2020. With people like yourself and Dr. O'Connor, there's a chance these people have an opportunity to get an actual medical doctor telling them the true science of these questions.
Thomas and myself, we have used steroids. We have trained a lot. We love bodybuilding. We love sports. Yeah. Casual doctors and regular doctors do not train. Therefore, they're not familiar with these substances. So you have to walk the talk.
Right. Yeah.
I mean, experience along with the knowledge.
Right. It's rare. It's very rare.
Very rare. Yes.
That's why we appreciate what you do, Doc. We really do. So thank you for what you do. Check out the doctor's book, Bodybuilding, the Good, the Bad, and the Ugly. It's an excellent, excellent resource to educate yourself on many of the matters regarding PEDs. You can get that on Amazon.com or the doctor's website, gtoul.com. Doctor, thank you so much for this week's show. Appreciate what you do for us. And everybody out there, we appreciate you watching. Please leave us some good questions for next time. And that's it. For Dr. Testosterone, Dr. George Toulianos, this has been Ron Harris. Thanks for watching.